Okay, good morning to everybody. My name is Claudio Saccavini. I am the tutor of the Today VIP Tour. It's a very pleasure for me to introduce you in this virtual VIP tour. Normally, the VIP tour during the regular Connectathon are performed in the Connectathon floor. That is another thing that to have an online VIP tour, but unfortunately this year the Connectathon is also online due to the COVID restriction. We hope that next year, the next Connectathon of 2022 will be on face-to-face Connectathon. And so probably we come back to have the regular VIP tour on the floor. So I can share my screen. One moment. Okay, so, okay, now do you see my slides? This is not a regular frontal events. So if you want to stop me with some questions, you can use chat, or you can use also your mic, what you prefer. This is the first VIP tour of these years. This is the map of the previous Connectathon. We can have a Connectathon from 2001. The first was in France, very close to Paris. And the last one in 2020, we have a Connectathon in Brussels in online format due to COVID. And also this year, we decided to have an online Connectathon. As I just said, we hope to have the next Connectathon in 2022 in face-to-face, to coming back to our traditional layout. This is the map of Connectathon. As you can see, we have a 20-year experience in Connectathons. That is very important because during these 20 years, we have support interoperability in a real-world deployment. So, what is IHE? IHE is an initiative that is not a standard body. It's not like HS7, for example, but is based on use case approach. So we're starting for the interoperability problems faced by user. This is important. IHE is an initiative in which we have two pillars. The first pillar is the user, and the second pillar is the vendors. User and vendors works together to solve the interoperability problems. So we're starting from the use case, then we transform the use case in a profile. Normally these activities is performed by domain committees. There are domain committees related, for example, to radiology, to laboratory, to infrastructure, or if you can see in the last part of the VIP tours, related to the patient content profiles, PCC. This is a very important domain in which we include all the profiles that are related to the content. In this case, we're talking about IPS, but we're talking later about IPS. This is very important because we make the Connectathon as the test of the profiles. So for example, the first year we have the trial implementation of the profiles. After one or two Connectathons, we have enough experience to move from trial implementation, the profiles, to the final text. And we continue to test these profiles during the Connectathon. Connectathon is not like an hackathon because it's completely different. Companies are not attending to the Connectathon to develop the products. Companies are attending the Connectathon to testing the products. So it's completely different approach. It's a rigorous approach. So for example, we have a pre-Connectathon test And during the 2 months before the Connectathon, all the companies that will attend to the Connectathon have to pass this pre-qualification, pre-testing, and normally these tests are against the simulator or peer-to-peer test. So after this first phase, we have the test plan that we tested during the Connectathon. During the Connectathon, the test plans are more complicated, more sophisticated, and these test plans are completely validated by the monitors. And we can see after, it's very important that this third part acts to validate the test. This is the approach during Connectathon. So, as we can see, we use a platform called Gazelle, in which we have a predefined test. Then we need to have at least 3 different test parties. It's not possible to test only 2 parts, only 2 vendors. Then we have the validation by neutral monitors. And after this, we collect all the test evidence in the test management platform in order to make the evidence of the test. And we have this list of registry of systems that have tested at the Connectathon. This is a culture different approach that participants have during Connectathon that is completely different from an hackathon. We don't want to discover something, but we want only to test the interoperability of different products. So IHE is, of course, an international initiative. This is very important because we want to ensure use, and we use the 80% of a profile that is completely global profile, and then we have, if we need, some 20% of localization. For example, in demographics, we have a PDQ that is a profile based on patient demographic queries, but you have some localization like German and French that use in particular way some attributes of demographic data. So we use Gazelle as test tools in order to minimize the deployment risk. This is the life cycle and the scale up of the profile, starting from the lab, moving to the real world. IHE is, as I just said, is more than just standards. This is a very important point. In our 20-year experience, we want to focus on robust standards. We want to use standards when they move from prototyping phase to a mature model, because we need that vendor implemented the standards in their products. This standard have fit to use case. This is another important point. So we use the use case approach to fit the standard available to solve the problem. And then we produce in the profile. And the quality testing of IHE profile is a key point during Connectathon. In our 21-year experience, we have discover and evolve. We started from the trust and collaboration, usually by face-to-face exchange. It's very difficult in the last 2 Connectathons that are completely online to produce this trusting between different vendors. Consider normally Connectathon floor is a big floor with at least 400 people around tables, around computer that work together for a week. And this is very important for the trusting base. We have, of course, new challenge for the online testing moving to face-to-face. Connectivity challenge. Consider the difficult to have a public network spread around the world. Consider that there are companies that are coming from Korea, companies from Europe, companies from US. And of course, the communication. So we improve our Gazelle platform with the communication tool based on Rocket Chat. So this is the numbers of current Connectathon. We have about 100 participants. We have about 36 registered systems. We are about 11 different countries that are testing during the Connectathon, and we have a coverage of 45 IHE profiles, starting from hospitals, centric use case, like, for example, radiology or laboratory, regional and national information sharing, XDS. For example, personal health devices. We have some companies that testing the interoperability between personal devices and systems like EMR and so on. And public health, of course, using. And very important, the IPS, that is the first time that we test in IPS. There are overseas by 29 monitors that are coming from different countries, not only coming from Europe, but also from USA, Turkey, and Gabon. This is the list of the monitors and the countries. It's very important because these are volunteers that are coming from different fields. Normally they are coming from university, user bodies, and so on. They are not coming from, of course, vendors. That is due because there are independent part. So this is my first introduction to describe what is IHE and what happened during Connectathon. This is the VIP tour stop. We're starting with the Connectathon introduction and the strategic role of IHE Gazelle test. Then we're talking with the vendor that now are currently testing during the Connectathon. And then we have to see what is, in which way we find the result of the Connectathon, and then we close our visit with the question, of course, from the floor. So this is the Gazelle platform, and Gazelle is very important. Now I give the floor to Steve Moore, that is in charge to oversee the complete part of PCC domain, of course, also IPS. Steve, if you want talking about Gazelle test platform, the floor is yours.
Claudio, thank you. Can I share my screen?
Yes, I leave. Stop share. Now you can share the screen. You take the screen. Okay, great.
Wonderful. So, well, this isn't what I really want to share, but I will work from this because I'm a little clueless. So let me talk about testing IPS in the context of Gazelle. And I want to talk about the general test cycle that is supported by Gazelle. So a technical project manager, and I'm one of several, we read the IHE profile, in this case, IPS. I'm going to try one more time, see if I can fix this.
Yes, you having...
Yeah, there's a way to switch screens, and oh, there we go. Now you great. This should be better. Now you're seeing my full screen, right?
Yeah, correct.
Great. Okay. So the technical project manager reads the IHE profile. We extract the requirements just as a vendor would do for their software development, and then we define the test strategy and the test cases, and we enter that information in the Gazelle master model. It is a application written by the Gazelle team that stores that information in their database. A Connectathon participant then will find a work list in Gazelle, which is based on their registration. The work list is in what's called Gazelle Test Management. That's the application that the participant and the monitor see. Each participant works through the test cases for all their registered profiles. IPS is one example. They complete each test and they mark it complete. A monitor also has a work list in Gazelle Test Management. They review the test evidence entered by the participants, either by looking at what's been uploaded into Gazelle Test Management, or they will schedule a session and review in person. As Claudio mentioned, when you're at a in-person Connectathon, you walk over, you look over their shoulder, you talk to them. It's a little more difficult in this remote environment. The monitor enters their assessment for each individual test case, And then at the end, the technical project manager looks at the individual assessments and provides a grade for each profile, each profile actor for each participant. And so this is all managed by the Gazelle test management system. When we first started, we did this with pieces of paper taped to a wall, and we would draw on it with marker. Now we have a computerized system that's been in place for a number of years. It's all worklist driven. It allows you to upload a number of different types of evidence, and it is certainly much improved over the last 20 years of our event. This is a picture of a test dashboard for a particular participant who is testing IPS this week. This detailed view shows the list of tests that have been defined, or a subset of the tests that have been defined, with the test names on the left side and some requirements on the right side to let them know what they have to do. So the participant will work through this test dashboard, select tests, select partners in test, run the individual tests, and upload the evidence as I suggested before. As they work through this, this is another view that's presented in Gazelle Test Management. This is a dashboard of their results. And so rather than the detailed view that I showed you before, this is a higher level view that shows them pass fail for the various results in their testing. And I want to call out two things. These bars will change colors as I assign passing grades to them. And you will also notice that for these, in this table, you'll see actor as content creator. And on the right side, you'll see option. And there are a number of options that are defined by the IPS profile. In this case, I want to go down to this line and show you that they have registered for the option IPS creator fire. The IPS profile has two separate paths. There's a fire path, in which case the system can create a fire document, and there's also a CDA path where the participant can create a CDA document. And this represents reality in the world where there are systems today that are creating CDA documents, and there are systems that will be creating fire documents for the IPS profile. And IHE wants to recognize both of those because those are things that you will see in the field for quite some time, the CDA documents plus the fire documents. And so we test both. The IPS profile covers both, Gazelle supports both, and as a project manager, I write test cases for both. I don't recall if Claudio showed this slide yet or not, so I may be.
No, I don't show this slide. I leave to you.
So I'm stealing your thunder, so I apologize for that. The IPS document, the main part of the IPS document, is a composition of a number of different sections. And I highlight that there are required sections: medication summary, allergies and intolerances, and problem list. And in the testing for this year, that is what I focused on as requirements for the participants. There are recommended sections, and you'll notice I highlighted immunizations, and that's certainly important in this COVID area. And I would just like to point out that one of our participants, actually two of our participants, got together over the chat, Rocket Chat, and said, we should add immunizations as part of our testing. So even though it wasn't required in the Gazelle, in our test cases this year, they got together and decided that they wanted to test that on their own and put that as part of their individual testing. So one thing that is front and center in this environment is that participants will often go over and above what we ask them to test because they find it important for their own individual work or for the profile in general. So I'm going to stop there and stop my share and pass it back to Claudio.
Yeah, now we move to the vendors side. Today, the vendor that represent all the community of vendors, because there are 4 vendors that are testing IPS at the online Connectathon. This is the first time that we test IPS profile. And so I move to Umberto. Umberto, if you want to.
Yeah, thank you, Claudio. Thanks. Hello, everybody. I'm Umberto Cappellini. I'm a technical product manager for the IOP team in Daedalus. Daedalus is an international company headquartered in Florence, Italy. But we have multiple other teams spread around Europe. And indeed, at this very moment, I mean, our office is in Vienna, Austria, and we are providing multiple systems and actors and profiles at this Connectathon. So I will share now my screen quickly. Yeah, here. Hope everybody can see my screen. Yeah, so why did we choose IPS? IPS is a very interesting standard. As Claudio said, it's brand new, and so it's the first time we test the Connectathon, even though Gazelle itself it's participating into the Connectathon since many years now. As we see the value that IHE brings to the company at multiple levels, so strategic, commercial, and not least technical level. We are able to improve a lot our products, testing and implementing IHE actors and transactions in our products. And IPS is nothing different. So we recognize that the value of this standard, and we implemented into this product, which is called Patient Synoptic. The Patient Synoptic is a product that provides an overview, a clinical overview for all clinical information about the patient. I have a very short example of what I'm talking about here on the right side. So, for example, for this patient, we do have multiple observations and documents like oxygen. It's everything in Italian. I apologize. Temperature and everything. And together with this overview, we implemented for this Connectathon a new widget, which is called indeed the IPS widget, which I'm going to show now. So we imported the two test patients of the Connectathon into our system, which are these two patients, Mary and Charles. I'm going to open one of them. So as I said, we have this this new widget for the Patient Synoptic product, which implements in this case, it's the fire composition. So as Steve was saying, IPS give you a possibility to access patient summaries in two ways, in both CDA and fire, which both support because they are both quite widely used in the market. CDA is the most used document presentation in the market at the moment, but fire composition is also going to be used and it's already started to be used a lot in the market. So this is why we support both. At this point in time, since we are quite still at the start of the Connectathon, I have only a fire example to show you. We didn't yet receive any CDI example, but this is the fire example. In this widget, we have a composition and a list of the documents for that patient, for the patient which was selected, which is Charles Merlot. We have only one composition. Obviously, we are testing in the Connectathon, so we don't have a wide range of documents at the moment. So clicking on view, we open, I try to move this on the right, on the left. We move we open the view for the patients for the IPS summary. So in this view, we collected all the section of the document. As we see, we have patient information here. I hope it's not too small, the screen. Then we have allergies, active problems, immunization. We even include for testing examples, immunizations, for example, for the COVID vaccination. Everything is coded as always in fire, and medication. So this is an example of IPS that we have now imported in our system. And just to let you know what's in the source of it. So this is what the original message looks like. So this is a fire message which is actually stored in the source creator of this message. All the sections are entries in this composition resource, and again they are displayed in this way in our application. Hopefully later next week I will have a chance to display and to show CDA version of these summaries, which looks obviously quite similar. In case of CDA, we may apply a different style sheet or ways to show up information, but the model is the same, and the content we are talking about the content profile here as all the PCC profiles. So the content is obviously the same. So yeah, that's it on my side, more or less. I will. Sorry, there's a bit of noise around. we are doing the Connectathon, right? Even here. So I will pass back the ball to Claudio now.
Okay, thank you, Umberto. You see this example, the application of Umberto working live on the Connectathon infrastructure. I believe that the document probably will be created by GNOME, I believe, if correct.
Right.
Yeah. The GNOME is the source of the document, and Daedalus is the consumer of the document. Very important to underline that we are at the beginning of the week, and so everybody worked to configure, to set up, to debug. The 2 first weeks of Connectathon is devoted to this part, and there are few documents in the repository and the consumer now, but as Umberto said, on Friday there are 100 documents in the repository, and it's important. Okay, thank you, Umberto. This is the end. I have only as last slide. Sorry that I share my screen. Okay. And this is the last slide I present. Yes, after the Connectathon, all the systems that have passed the testing phase are collected in this registry, in which you have all the results of the Connectathon, of the previous Connectathon, divided by actor and by vendor. And so this is the link, and you find on this link all the information of vendor and system that have passed the Connectathon. This is the end of our VIP tour, and of course I open question to the floor. So if there are questions, you can use your mic, or you can use your chat as you prefer. I open stop sharing so I can see the chat. Yeah. Yeah. In the chat you find the correct link. Are there some questions from the floor? No question, great. So if there are no questions, I can invite, oh, yep, pretty clear, and thank you. I invited you to attend to other events during this Connectathon experience. In particular, there is in the afternoon a very interesting event related to IPS, because it's an event in which we're talking about different approaches in COVID-19 vaccination. You see that there is at least 3 different approaches. How many individual testers from Asia? I believe that few people from Asia are testing. Probably one company of IPS are coming from Korea. And
yeah, we need to receive the first documents from the Korean company.
Yeah. And we have to say that IHE is a global initiative, but there are regional connectathons. One connectathon is in Europe, another one is in North America, another important one is in Japan, and there is also a connectathon in South Korea and China. There are different connectathons in different regions. With this outbreak, of course, of COVID, we have moved from face-to-face connectathon to online connectathon, and the connectathon has become more global than the previous face-to-face connectathon. Probably we in the future have a different layout for the next connectathon based on face-to-face with some connection from other parts of the globe. Consider, for example, that there was a first tentative of IPS testing during the last North American connectathon, but there is no sufficient companies registered, and so probably 2 companies are attending to European connectathon to have the capabilities to test IPS, because in some profiles there are a lot of companies, a lot of actors registered. With some other profiles, there are few companies involved, and so we need probably a global response to this project. Projectathon and over next month are the plan. Yes, I don't believe that the IPS is currently inside the projectathons, but there are some projectathon like Swiss projectathon in which we have also fire documents and fire parts. I don't know if they plan to have also IPS, but Alexander is here, I believe, and probably Alexander could be more precise than me. Okay, other comments or questions? And time zone, yes, time zone is a challenge in an online connectathon because, for example, Steve is from East Coast, or from Washington, if I remember correctly, Steve. And so for him is a problem, the time zone, of course, but also US Central, yes, US Central. And time zone is a problem, and it's not so easy to work with different time zone. Time zone is one of the reasons that, in my opinion, connectathon will remains regional, because as Steve said, connectathon is also a socializing from different vendors. This is very important part of the socializing. Okay, other question? If not, I invited everybody to attend to the other session of the Connectathon Experience Week. Thank you very much to everybody. Bye-bye.